All right, now we're going to look at chapter 8, which is going to focus in on the appendicular skeleton. This is also going to review the material for lab 10. So make sure that you go over lab number 10, and this can be used as a review. So like we talked about earlier, your skeletal system consists of 206 bones, but 126 of these are part of the appendicular skeleton. Now the appendicular skeleton is mostly going to be what we would consider your arms and your legs. Now this does include bones that make up the pectoral girdle. Those are going to be the girdle that holds your arms or your upper limbs to your body. We also see the bones of the pelvic girdle, which are going to hold the lower limbs to your body. These girdles allow for attachment to the axial skeleton. Now the function of the appendicular skeleton is primarily concerned with giving you movement abilities. So let's look at the pectoral girdle first, or what we call the shoulder. This includes the clavicle, known as your collarbone, and your scapula, known as your shoulder blade. It's going to allow you to incorporate the head of the humerus. All right, so if we take a look, so these are the two bones we're looking at. We have the clavicle and we have the scapula. These two interacting together are going to allow the head of the humerus to attach in here for attachment. Now the clavicle, guys, is more of an S-shaped type of bone. It does have what we call the medial end, which is going to articulate with the manubrium of the sternum. It forms the sternoclavicular joint. So it's going to have this area which goes into the sternum. This is going to be the medial end. The lateral end is going to articulate with the acromion of the scapula, forming what we call the acromioclavicular joint. Okay, this is what actually, when this comes away from the acromion, okay, which is this area like this. Okay, so this is what the shoulder kind of looks like. When these two come apart, that's what we call a separated shoulder or dislocated shoulder in that sense, where this part is separated away because the clavicle and the acromion of the scapula have been detached. Okay, so make sure you know that the medial end looks like this. Okay, that's going to be the part that goes up against the sternum, and the lateral part is here, which is going to come in contact with the scapula. Now, the scapula is also known as the shoulder blade, and so when we look at the scapula, there's a number of different markings that you should know. We do see that you have the spine. This runs posterior to the scapula, so it's going to run on the back of the scapula. We then see that you have the acromion, which is going to be this area right here. Okay, so it's up on the top part of the actual spine. You then have this area, this little hook that you see here, which is the coracoid process. Okay, so the coracoid process is going to be a projection which allows attachment in tendons as well. Then you have the glenoid cavity. So this area right here, this type of fossa that's located here is known as the glenoid cavity. Now, guys, you need to make sure that you can tell a right and a left of the scapula. So if you'll recall that this part has to go towards the back. Okay, this is posterior, so it has to go towards the back area. And this is where the shoulder fits. This particular case, if I was to hold it by the spine, this would be my left shoulder. Okay, so if you'll notice here, this would be the left one because it allows a shoulder. If I put this on the right side, do you see how you can't see the glenoid fossa? Okay, and so this is not the correct side. We need to have it here so that you can attach the actual humerus to it, right, for the arm. So this would be a left scapula. Now, the shoulder region is the upper part of the limb, and it's attached to the trunk, and we do see when it gets dislocated, it's a shoulder dislocation. We then have the arm, which is the upper limb between the shoulder and the elbow joint. This is going to be composed of one bone known as the humerus. We then have the forearm, which is going to be between the elbow and the wrist, which is going to be made up of the radius and ulna. And then you have the hand, which is the distal part of the limb, which is going to be distal to the wrist. And it is going to be composed of the carpals, metacarpals, and the phalanges. So let's take a look at the humerus. So with the humerus, this is known as your arm bone, and it is going to have two articulations. It's going to articulate at the proximal end at its head end with the glenoid fossa of the scapula. On the distal end, the far end, it's going to attach to the ulna and radius to form your elbow. And it looks a little something like this, because this is going to help form your elbow. Okay, so it's going to allow for that structure on the distal end. Now, some landmarks or some markings you need to know on the humerus. We do see that you have the tubercles, these two rounded projections that are located here. In between them is the sulcus. Okay, so we see the sulcus running in between those. You have the greater and the lesser. The greater is just more lateral and the lesser is more anterior with the tubercles. That intertubercular sulcus or groove is between the tubercles, and this is actually where the biceps head of the biceps muscle is going to be located. We then see that this kind of projection here, this rough area, is known as the deltoid tuberosity. You then have the epicondyles. These are lateral and medial. And then you have the actual, these condyles do have names. So we do see that the lateral condyle over here is going to be, we do see that the lateral condyle that's here is going to be called the capitulum. And this is going to allow for the proximal head of the radius to come in. Sorry, we have the trochlea, which is over here, which is going to be where the, it's going to have it's going to attach to the proximal end of the ulna. Some other humerus landmarks are going to be the neck. The neck is going to support the head. Now there is what we call the anatomical neck, which is going to be right around the head region here. And then we have the actual surgical neck, which is located here. We also see that there's some fossa or shallow depressions that are located down here towards the distal end. We have the radial fossa and also the coronoid fossa, which are going to be present here. And then the olecranon fossa is here on the back. Okay, so you have the olecranon fossa here for the elbow, and then you have the two front here for the radial and coronoid. All right, so moving on down, let's talk about the radius. The radius is more of your lateral on your hand. Like if you're in anatomical position, it's going to go to the thumb side of your hand, whereas the ulna is more medial and it's going to go to the pinky. The radius and ulna diaphysis shafts are actually connected by an interosseous membrane. Okay, and you can see that here. We do see that there's what we call the radial ulnar joints, and on the proximal end, this is where the radius head is going to articulate with the ulna, and at the distal end, the ulnar head is going to articulate with the radius. So they're kind of opposite. So let's look at the radius first. So when we look at the radius, this is on the thumb side, we do see that it has the radial head, which is going to be towards the elbow, the proximal. We also see that we have the radial tuberosity, and this is going to be where the biceps actually attaches. On the other end, on the distal end, you can see this little point that's located right here. This is known as the radius styloid. Okay, so this is a styloid that's down. So you have the radial head, and then you have the styloid. The radial head's on the proximal end, the styloid's on the distal end. All right, so now the ulna is a little bit different. We see it's going to be on the pinky side. The proximal landmarks that are going to be towards the elbow are going to be the olecranon. This is going to be this back part right here. It's known as the olecranon. This is actually the part that's your elbow. So when your elbow is bent, you can feel that right here. That's the olecranon process. We also see that there's this notch here. This is known as the trochlear notch. And then we also see that this projection that's right here is called the coronoid process. So this projection, so we have the notch and then we have the process here. All right, we also see that right here in this area, there's this flattened surface here, which is known as the radial notch. And this is where the radial head is going to sit. See if you'll notice how it allows for that head to sit in there and turn. That's why there's that notch there in the bone. The distal landmarks on the distal side towards the wrist are going to be the styloid, but this is the ulna styloid. Okay, it's going to be more medial. And we also see the ulnar head. So this is the head region of the ulna. All right, so this is showing you the landmarks of the ulna. Now, the articulation that takes place here at the elbow, you will notice that you have the humerus attaching to the ulna and the radius. This is going to allow for that elbow joint to form. And if you'll notice, these special kind of markers that we learned are going to be seen here in this joint as well. Moving on down, we do see that there is the hand. The hand is composed of the wrist, palm, and fingers. The wrist or the carpus is made out of 8 carpal bones, and they are arranged in 2 separate rows. We then see the palm, which is the metacarpus. These are 5 metacarpal bones, and they have an area known as the base, the shaft, and the head. And the head is going to be where we actually see our our knuckles right here. Okay, so we have the base, the shaft, and the head. We then have our fingers. Our fingers are made out of 3 phalanges each. There's going to be a proximal, a medial, and a distal phalange. The thumb is an exception where there's only 2. So there is a proximal and a distal. Okay, there's not going to be a middle in this case. And so if we take a look at the hand, we do see here are the carpals, here are the metacarpals, and then here are the phalanges. If you'll notice here in the phalanges, there's 3 bones, 1, 2, 3, in each of them except for the thumb. Okay, and so when we look at this is going to be proximal, middle, distal. Proximal, middle, distal for each of them. Now, with the pelvic girdle, as we move on, we're going to see that the pelvic girdle moving down to the lower extremity is going to connect the bones of the lower limbs to your axial skeleton, and it provides support also for your vertebral column, pelvis, and it houses a lot of times the lower abdominal pelvic organ. So it helps give some protection because of those large crests that we see here. Now, the pelvic girdle is made up of 2 coxal bones. Okay, so this is what a coxal bone looks like. And there's going to be 2 of them. We do see in the anterior surface at the front that they're going to join together in what we call the pubic symphysis. It's right here, the pubic symphysis. In the back, they're going to join with the sacrum. So this is why it's known as a sacroiliac joint at the back, okay, because it's going to attach back here where my thumbs are to the sacrum, all right, creating that pelvic girdle. Now, each coxal or hip bone is going to consist of 3 bones that are fused together. We have this top part right here, which is the ilium. This part right here is known as the pubis, and this back area here is the ischium. So the ilium is superior, the ischium is inferior and towards the back, and the pubis is inferior and towards the front. We do see that these 3 are going to combine here to create what we call the acetabulum. This is a socket where the actual head of the femur is going to fit. Okay, so you can see that ball and socket that forms right here. It allows that head of the femur to fit in there, okay, the acetabulum. We also have what we call the obtutor foramen, which is a hole here which allows for the passage of a lot of blood vessels and nerves. Now again, make sure that you can tell a right or left of the hip bones. Okay, so when we're looking at this, if you were to take this obtutor foramen should face forward with the pubis facing also forward. So in this case, this would be a left. In the other case here, if I'm holding it like this is a right. Okay, because my leg attaches here. If I was holding it like I should over here, my leg can't attach medially. It has to attach laterally. So this one's a left, this one's a right. Now, the ilium, guys, is the largest of the 3 hip bones, and it forms the pelvis. We do see that it's formed of the iliac crest, which is right here at the top. A lot of times when you put your hands on your hips, you are putting your hands on your iliac crest. We also see that back here in the back, you're going to see the greater sciatic notch. This is going to allow for the sciatic nerve to pass through. And we also have the anterior superior iliac spine. Okay, that's going to be over here towards the front. Okay, so let's go over here towards the front. On the ischium, the big thing you need to remember is the ischial tuberosity. This is going to be the most prominent feature on the ischium, and this is the part you actually sit on. You sit on your ischial tuberosity. That's why when you sit on a hard surface, sometimes it gets where it hurts. Okay, it's this ischial tuberosity. Now, when the pelvis is put together properly, we're going to see that there is what we call the pelvic brim, which is the inlet. So that's the inlet where we're going into the pelvis. The false pelvis is superior to this. So when we place these together, okay, if they were together, this false pelvis is up here because this would be the inlet. Okay, so the false pelvis of superior of it, this contains the lower intestines and the urinary bladder when it's full. This is also where the uterus, ovaries, uterine tubes in females is located. The true pelvis is going to be below that brim. It's inferior to that brim. And this does contain the majority of the bladder. It's going to have the vagina and the cervix in females and the prostate in males. We do see this true pelvis has what we call an inlet and an outlet. But here it's showing you the false pelvis is going to be the upper part and the true pelvis is going to be the lower or inferior part under that inlet. So a male and female pelvis are going to be a little different. In general structures, the female pelvis is going to be a little lighter and thinner. The male's is going to be heavier and thicker. We do see that the false pelvis is going to be more shallow in females, if you notice here, whereas in males, those iliac crests are going to be higher, and so it's going to be a deeper type of a false pelvis. The brim is going to be wide and more oval in females, where it's going to be more narrow and heart-shaped in males. The acetabulum is going to be smaller, and it's going to face more anteriorly in females, but it's going to be larger and more lateral in males. We do see that the ortuber foramen is going to be more oval in females and round in males, and the pubic arch is going to be greater than 90 degrees in females and less than 90 degrees in males. Now, there's a couple of reasons for this, and the main reason is for childbirth. We need those rims to be more shallow. We need the opening, the brim to be wider and more open, as well as a greater angle in that pubic arch to allow for spread so that the baby can fit through the canal. So with the lower limb, we have the gluteal region, which is between the iliac crest and the hip joint. You then have the thigh, which is between the hip and the knee joint, which contains the femur. The leg, which is between the knee and the ankle, which is going to consist of the tibia and fibula. And then we have the foot, which is going to be distal to the ankle, which contains the tarsals, metatarsals, and phalanges. So guys, the femur is the thigh bone, and it's the longest and heaviest as well as strongest bone in the body. And if you'll notice, it is very large. On the proximal end, you have the head of the femur. This fits into that acetabulum of the hip to form the coxal or hip joint. On the distal end, you have what we call the medial and lateral femoral condyles. These are going to articulate with the tibia, not the fibula, to form a knee joint. So if we take a look at this, we see that they're going to fit together here to form your knee joint, but the fibula is not part of this. This is just the femur and the tibia. It also is going to articulate with the patella. Okay. So it's going to articulate with your patella, which is known as your kneecap. On the femur, there's some landmarks. We do see in the head, there's this little structure, this round structure that's called the fova capitis. This is where a ligament actually connects the head of the femur to the acetabulum. We do see the neck located here. This is often the place when somebody breaks a hip. They've broken the neck of the femur off. We also see on the posterior back side of the femur, you're going to see the trochanters, these large projections here, and these are going to be the greater, which is the top one, it's bigger, and the lesser, which is the inferior or smaller one. These are going to be for large muscle attachment areas on the femur. When we look at the lower part of the thigh, when we talk about the distal end, you do have the epicondyles, and then you also have the condyles. So the epicondyles are over here on this side. You can see them a little bit better right here. They're on the side, and then you have the condyles located here. Now these are going to articulate with the tibia, and these epicondyles are going to allow for attachment of the knee muscles themselves. Now the patella is known as the kneecap. It's the largest and only named sesamoid bone that there is. Now remember, a sesamoid bone means that it's going to be embedded in a tendon. This allows us to reduce friction on that tendon. The posterior surface is going to have thick articular cartilage on it, and this is going to form the patellar femoral joint. Now this can be compromised when we see somebody who has runner's knee, okay, where we do see that the patella is supposed to move very easily across this surface or this groove that's here, but in runner's knee it gets off to the side. Okay, it gets to be wrapped too strong, and we see it gets pulled out of that joint. Now, the two bones of the lower limb are going to be the tibia and the fibula. Now, the tibia is going to be the more medial bone, so it's going to be towards the inside, and it's the larger of the two bones, which means it's going to bear all of the weight. The fibula, on the other hand, is more lateral, and it's just there to stabilize the ankle joint. Now on the proximal end, we have what we call the tibiofemoral joint or the knee joint. This is where the tibia is going to connect to the femur, and the two condyles are going to articulate, the lateral and medial. And so this is actually going to form the knee, So this is actually going to form the knee joint. Okay, so you can see it here, the tibiofemoral articulation. Now there is no fibula in this articulation. We do see that there's also the tibiofibular joint that does take place up here. And this is where the fibula is going to attach, okay, to the tibia. So it's going to attach here to the actual tibia. Okay, so it does not attach up here at the knee. It's going to attach down here to the tibia. On the distal end, you do see that it's going to articulate down here with the tibia again. And it's also going to articulate with the talus of the ankle or the foot. Okay, so it's going to articulate here with the talus. All right, so you can see the structure of how the foot fits in to this structure. Okay, this is called the tibiofibular joint as well. So landmarks on the tibia, we do see that this is your shin bone, and it's going to have this nice structure spine right across here. But the big thing is it has this tibial tuberosity, and this is the attachment of the patellar ligament right here. We also see that it has the medial malleolus, which is this guy. This is going to articulate with the talus at the ankle structure. The fibula, on the other hand, is going to have what we call the lateral malleolus. It's going to go to the outside, and it's going to articulate with the tibia and the talus to help form that ankle structure. The tibia and fibula are joined by that interosseous membrane that we saw similar to the radius and ulna, so it's helping hold these two bones together. So let's move down to the actual foot. Now, on the foot, guys, there are several of these bones you do need to know their actual name, and they have unique reasons. So when we look at this, there's going to be 7 tarsals that make up the ankle. Now, the first one here is the calcaneus, which is located right here, and this is your heel bone. It's the largest and strongest bone in your foot, and this is known as the calcaneus. Right here, which is going to articulate with the tibia and the fibula, is the talus bone. All right, so you have the calcaneus and you have the talus. You also have the other tarsal bones located here. You then have the metatarsals, which are here. These are going to form the arch of your foot, the sole of your foot, and you have 5 of them. 1, 2, 3, 4, 5. We also see that then you have your phalanges with the toes. Now, just like we saw with the fingers, your toes are also composed of 3 phalange bones. We do see that there's the proximal, the middle, and the distal for all 3 toes except the big toe, known as the pollex. Okay, so known as the hallux. Okay, so the hallux is the big toe, the pollex is the thumb. But you'll do notice that there's just going to be a proximal and a distal when we talk about the toe. When we talk about the big toe.